Hello everyone, my name's Deborah Garlick from Henpicked, and I'm delighted today to welcome you to our session on menopause and its effect on aging. Now, this one's a little bit of a different one for us. We always do sessions on menopause, but it's usually menopause and health. But today I'm delighted to welcome Dr Liz McCulloch from Hormone Health, who is not only a menopause expert, but is also an expert in aesthetic medicine. And this is why, Liz, we think that this topic is so popular. We got this email, and thank you to everybody who sent us some questions. It says, I am 64 and I'm shocked at how I've aged. I'm physically quite fit for my age, but my appearance is so depressing. I really dislike looking at myself in the mirror, so I really do. It shocks me. Therefore, my self-esteem and self-confidence are at a low ebb, and it can only get worse. That is why we're running the session today. Whilst it's not about health exactly, how we feel about how we age. And to be fair, how many of us look in the mirror in the morning and say, you know, that can't be right. So I'm delighted to welcome you, Liz, so that you can take away some of the mystery around menopause and its effect on aging. Hello.
Hi, Deborah. Thank you so much for having me. I'm really excited to be here.
Well, we're going to jump straight in, Liz, because we've got half an hour. And for anybody behind the scenes that's joining us today, my colleague Sally is manning the Q&A, so do keep those questions coming. We'll try and answer as many as we possibly can at the end of this session. But jumping right in, Liz, what effect does menopause have on aging? And for that matter, what influences the aging of our face?
So the menopause is basically a decline of your main hormones, your estrogen, your progesterone, and your testosterone. And it doesn't just start when you have your last, your final period. It already starts the years leading up to that, so the perimenopause. And the hormones are like an intrinsic factor to your aging. So estrogen can have a positive effect on your cardiovascular health, but it also has an effect on your skin and on your bones and also on your sleeping. So we can look at how those work together. And sleeping is another intrinsic factor. So we know that sleep deprivation makes us age faster. Yeah. And another intrinsic factor is on a genetic level. So there is a lot of research going on at the moment about sirtuins, which are enzymes that they're like a longevity gene. So we know that caloric restriction and, for example, exercise, everything that puts the body into stress may activate those sirtuins, which then in return activate like a DNA repair. But this area really needs more research. And if you're interested in it, I can recommend you a book from David Sinclair. It's called Lifespan. It's really good.
I think I'll get that. So the things that are affecting us then during this time, there's the changes in our hormones. And then when you say intrinsic and extrinsic factors, what do you mean? What's the difference between the two?
So intrinsic is anything that comes from inside. Extrinsic are things that come from the outside. So for example, photo damage. So you could protect your skin from photo damage by wearing an SPF 50. If you do that, then you do need to consider vitamin D supplementation, because your body might not absorb enough, you might not get enough sunlight to build enough vitamin D. So that's one thing to consider. Another extrinsic factor, one that you can regulate yourself, is smoking. So smokers will break down the collagen, and you see those fine lines around the perioral area. And then sugar, for example, is another extrinsic factor. So having a high sugar diet attacks the collagen. So for example, it builds AGE complex, that's advanced glycation end products, which make your elastic fibers, so everything that keeps your skin elastic. The AGE complex breaks down the elastic fibers and makes them more rigid. And extrinsic you would also call environmental factors, for example. So the use of antioxidants like vitamin C serums, they may help to reduce the oxidative stress on the skin.
That's excellent. So we'll come back to what we can do, because I'm pretty sure we all want a shopping list of top tips. But actually some of those intrinsic and extrinsic factors, we can influence them more or less ourselves. So stop smoking, stop being a sun goddess, actually wearing your sun cream if you're going to be going out there, all breaks down. Now, we often associate aging with just wrinkles, but one of the things that you mentioned there that surprised me when we were talking about this a couple of weeks ago was bone, the effects of bone post-menopause.
Yeah, so estrogens are known to prevent fractures later on in life. So if you're prescribed bioidentical HRT for systemic reasons, let's say you have hot flushes and night sweats, one benefit of it is that it will also protect your bones. It increases the bone density. What we see in aging is that our face, our skull actually changes. So our eye sockets, they widen, and our brow, it recedes, and our chin changes as well. So that, of course, has then effects on the superficial layers of the skin. So you will see a deepening of the marionette lines. You may see a sloping neck contour and pseudojowls. Also, this muscle here, the mentalis muscle, becomes stronger, hyperactive, which in return can make this labial mental crease deeper. So there are things that we see and we understand how the bone changes has an effect on the face. Now, as we know, estrogen can help with bone density, and there's been a really interesting study in the Journal of Periodontology proving that estrogen and vitamin D and calcium has increased the bone density of the mandibular bone here. But whether or not that actually changes the aging of the face is not yet proven. So we need to research more into this area, but it's really interesting.
We do. So there's the skin, there's the superstructure, your bones underneath, and you mentioned the muscles before.
Yeah, so muscle health, so that's what you exercise. So if you feel tired and you have a loss of testosterone, women begin to feel more fatigued. This is more for your overall health. So the muscles of the face don't change in particular. It's more the fat pads that move down, and you see a changing of the triangle of youth. So when we're young, we have our fatty compartments up here, and it's like a triangle like this. And as we age, those fat compartments shift down, and we have a triangle like that. So there are changes in all the different layers: the skin layer, the bone layer, and the fat layers.
Wow. So how you mentioned the triangular of the face and fat pads starting to move down. For those of us who never had that, what's known as the stereotypical beautiful oval, so that's where we tend to have more weight around below our midsection, is it?
Exactly. So for example, you might see that those lines here forming deeper, and you might see the jawline, kind of the jowls becoming less defined.
Right, okay. So you've described how aging of the face may be experienced, what we might see differently in ourselves. What can we do about it? What's your top tips?
So top tips. Well, we covered already a little bit about all the things that you can do to have a healthy lifestyle. Yeah, so SPF 50, exercise, diet, keeping hydrated, not smoking, having a low sugar diet, maybe, wearing some antioxidants. From the skincare point of view, you could use a retinol cream, because that is proven to help with fine wrinkles. So there's lots of skincare little tricks that you can do on a deeper layer. If you want to see it from an aesthetic point of view, you could use some dermal fillers, for example. So to counteract that movement here, you can cleverly place tiny volumes of hyaluronic acid, which is a dermal filler, which is identical to the collagen that you naturally have in the face. And it creates a lifting effect. But really the trick there is less is more. So small amounts, like half of a tip of a teaspoon, and it creates a lifting effect, and it's just cleverly placed. You don't really want like chipmunks like this.
Now it's very interesting, this one, isn't it? Because I'll let you into a secret. When with all of the articles that we have on Henpicked, it's the Botox ones and it's the dermal filler ones that are always popular. And if we post them on social media, nobody likes them, so they don't want their friends to know that they're there and that they're looking at it, that they're considering it. But nevertheless, the click-throughs go quite bonkers sometimes. And you know, to be clear about it, I'm very much for natural aging, embracing how we look now, because in 10 years' time we're going to look back and think, gosh, I wish I looked like that again. But if you get up in the morning and think, well, that can't be right, or I'm happy with the way I am, or this wonderful woman that sent in this this question, you know, if there's just one or two things that are bothering you that you can do something about, then why not?
Absolutely. So I think nobody needs any treatment. So it is really about, you know, when patients come to me and see me, I usually ask, what is bothering you? And then if they ask me to go further, we can do a full facial assessment. But normally we just treat like the area that is bothering you. So many patients, for example, their partner might say, you look so angry, and they don't feel angry, they are really happy. But what happened is that over time, that muscle here has become so strong that they constantly look angry. Or, for example, this muscle here, the depressor anguli oris, or the downturn muscle of the mouth, has become overactive, and you start to look sad, and you're feeling happy. So that's easily helped with a tiny bit of Botox. Obviously, Botox is not for everybody, but if someone wants to have a little bit of help, it's not about looking like 20 or like 20 years younger. It's just if you want a little bit of help, it's about looking good for your age.
Botox has come a long way, hasn't it? Because I know I tried Botox in 2012 to write an article about it and didn't bother after that. But for me, it was the feeling of it felt a bit too, you know, flat, restrictive, and my face naturally moves a lot, so I didn't think it was for me. But what surprised me when we were talking before was the developments on dermal fillers and Botox, particularly, did you call it baby Botox?
Yeah, I call it baby Botox. Personally, I really don't like a frozen look. It may be the right thing for some patients, but if I speak to someone, I 100% always recommend a natural look. So just reduce the dose of the Botox to about half. That still kind of slows down how strong those muscles contract. And by having a softened movement, you don't form the lines as deep, but you don't have those frozen faces and, you know, that feeling of heaviness. If you've had it before, you might know it from a practitioner. But if you just reduce the dose, you can have very natural expressions, still move everything. I mean, everybody likes to have a few lines here around the eyes. It's just not natural to not move when you're smiling. And also we know that, you know, the Greeks, they had that belief that there is a split between the mind and the body, the mind-body split. But we have discovered that actually the mind and the body might be linked much more than we thought previously. So using a tiny bit of Botox here can actually help with depression. So not being able to look angry also lifts our spirits. So there is interesting evidence. And similar with that mind-body split is similar with testosterone and libido. So you might be in a relationship, your testosterone levels drop, and suddenly you admire your husband, you haven't had sex for, I don't know, a day, a week, a year, whatever the time frame is, and your mind is telling you, I really would like to have sex again, but because you don't have the hormones, you might not have that drive, that inner drive. So a little bit of off-lyse testosterone might help bring back the energy, which in turn may make you to do more exercise again, and to improve your libido. But that's another example of that mind-body linking together.
Thank you very much, Liz. And when we were talking before, and everything that you said about collagen, keeping it and doing something to boost it with dermal fillers, etc. The analogy that we used was plumping up a cushion. So, you know, getting it fuller if you can. And also you called it ironing the pillowcase, keeping your skin smooth and using good facial products and exfoliation to get that smoother. I'm pretty sure that that was what we were saying about a little bit of housekeeping there if you want it. But I'm pretty pleased that you said nobody needs it. It's a personal preference. I'm just going to check in with Sally just for a moment and see what the questions is. But can I just ask you about hair? Because that is another hot topic that a lot of women ask us about, hair thinning.
So hair thinning is another complaint that is very common in the menopause and is often associated with the drop of the estrogen levels. But of course, it can have a lot of other reasons as well. But what we can offer is a blood test to see if you have enough zinc or enough iron in your blood. And women experience often, rather than patches of hair, like a thinning of the hair here on the sides and on the top. And especially, you know, during the pandemic where we're on Zoom all the time, women, it can really affect a woman's confidence and actually lead to depression and just overall self-esteem. So, you know, estrogens help if that is the reason for the hair thinning, but you could try other products like topical minoxidil, for example, which is a shampoo. But all these things, because the hair grows so slowly, it will take a long time to see an effect.
Thank you very much, and I'll make sure we've got a link to minoxidil in the article. Sally, how's the questions coming along?
Yeah, well, hair actually came up as one of the questions, so that's great. We've covered that. So we've got lots and lots of questions. So I'll just go through some of them. I'm trying to summarise because we're say inundated, which is absolutely fantastic, and do keep them coming. So the first one was around collagen supplements and what your thoughts are on that in terms of whether that's something that's of benefits from a skin and aging point of view.
So personally, I can't really comment on collagen supplements. Personally, I haven't done enough research to see whether or not they are beneficial or not. So on my personal side, I am not recommending them because I still need to be convinced, but they are available, and I don't want to say either way that they're not effective or they are effective. But we need to do more research into how, you know, what they're actually doing. Is it worth it?
Absolutely, and I think that's the same with a lot of things that people may take or try. It's about doing that research and understanding where's the information coming from and making informed choice around what's right in terms of any treatments. Some people have mentioned facial exercises and facial yoga and things like that, to see any thoughts that you had on the impact that could potentially have.
Yeah, I think relaxing your muscles, you can train yourself to be more relaxed. Anything that will stop you constantly frowning or constantly looking sad will have a benefit. So if you manage to just, you know, de-stress and do some yoga, I have not seen the research, but there can't be any harm. And from a hormonal perspective, we also know that if you're using CBT or, you know, meditation exercises, it can reduce your levels of cortisol, which in effect will increase, because cortisol steals away from the production line from cholesterol to progesterone and estrogen and testosterone, which are the feel-good hormones. So if you do meditation, it also boosts those feel-good hormones. So it has a lot of benefits.
Brilliant, thank you. Someone's talked about ways of increasing bone density naturally. So, you know, some ideas on things, and I know we've talked about exercise being so important, and really important part of it, and what we eat. Anything in particular that you would recommend? There's a few people that have said that they've got osteoporosis in their family, and they're really conscious, and they're not, you know, maybe not chosen to take HRT or can't take HRT, and anything they can do naturally to really improve their bone density and bone health.
Yeah, so if you have a family history of osteoporosis or hip fracture, for example, which can have a huge impact on the quality of life when you're older, you can draw a conclusion it will impact on your personal risk if you have a family history. So the things we know is that estrogens help with the bone density, but if you, for whatever reason, you're not allowed to take them because you have a contraindication, then exercise is fantastic. So any impact in exercise like running, weight training is also important. And there is one study which shows that jumping off, obviously if you're fit enough to do so, from a meter down from one of those mats, the impact of that will also increase your bone density.
Excellent, thank you. And a lot of people have talked about things like spots, breakouts, aging, things that are happening, describing their skin as like they were when they were a teenager. Again, any suggestions or things that you think people could focus on doing to really help and improve that?
So there's this is such a wide topic and you can't really generalize it. So it could be hormonal, it could be like adult acne. Now that we're all wearing the facial masks, we know that we're breathing in, our spit. So our kind of the humidity of the face, and spit is there to break down our food. But equally, the saliva also, makes our skin more sensitive. So with breakouts, you could look at exfoliation. You can look at retinols, for example. They are fantastic in reducing the pore size and reducing acne as well.
Brilliant.
And changing your face mask. Yeah. So,
yeah. Absolutely. There's quite a few questions that are very general in the chat box at the moment. So I'm going to make sure that I answer some of those offline around vaginal dryness and about facial exercises. And this one that does remind me of me says, I find it difficult to keep up with people who are fast talkers. Is this a menopause symptom? I don't know. Did that happen to you before? I know I certainly have to say that again a lot now. But CBD is an interesting one around, does CBD, do you have any experience of whether that helps with fatigue and aches and pains?
So CBD is proven to be slightly effective with hot flushes and night sweats. I'm not too sure about fatigue, so I would have to research into that area. But what you mentioned with the cognitive function, that is recognized that during the menopausal transition, you may have difficulty word finding, your concentration may be worse. But the good news is that as you dive out of that menopause, usually the cognitive function improves again.
That's fabulous. One question, and I know, Liz, this isn't a sponsored session, so somebody said, which brands of skincare do you recommend? And when we've talked before, we've said, not really the brands, look for the ingredients.
Yeah, I try always to not mention skincare brands, but things that you can, ingredients, so medical grade ingredients that you can look for are retinoids. So they are highly effective in keeping the collagen, treating fine wrinkles, and treating pigmentation as well. Then topical hyaluronic acid you could try. Obviously, skin protection is my number one. So your SPF 50 is really worth investing into a good sunscreen. And you can also, if you remember that I mentioned this AGE, there are some skin companies that offer an AGE interrupter. So if you Google it, I think you will find it, and that helps prevent that premature skin aging through the sugar.
You mentioned in having an SPF, the importance of potentially vitamin D. Can you just expand on a little bit more? A couple of people have asked questions around that in terms of what kind of supplementation should people be taking, in terms of how much and why that's important.
So we only absorb enough vitamin D between March and October, and only if we're not wearing sun protection, and only if we have our décolletage exposed and we wear a t-shirt. So quite often we spend days in the office or, you know, not outdoors to, even without an SPF, absorb enough vitamin D. So that's why insufficiency is very common. So I think a good way, rather than to generalize saying everybody should be taking vitamin D, I mean, if you are every day wearing an SPF, I think there is a good argument that you're not going to absorb enough, and I would recommend supplementing one. Within the dosage, standard dosage is 400 international units per day, but some patients may need up to 1,000, but I would always discuss that with your doctor and you know, individualize it for your own needs, and you can test your vitamin D levels as well.
Excellent.
Thank you very much. Can I just ask one question about testosterone, because you did mention it? Is the question around, does this have to be prescribed by a doctor?
Yes, 100%. So I am aware of some pharmacies now offering it, but it is a prescription-only medication. It's off license in this country, and we only ever prescribe it if your own testosterone levels are low. So I would completely, you know, warn against using it without a doctor looking after you. It also needs monitoring, so we would check your testosterone levels before and then into the treatment to make sure that you maintain a normal female range. So we only, although it's known as a male hormone, we only ever give a small amount. Yeah, so we would not give like a high dosage.
Thank you very much, Liz. And I'm looking through the questions. I'm going to send on some information, and of course we'll send this recording on, but weight has come up a few times, and belly fat. We have a recording with Jackie Lynch, nutritionist, so we'll send that on. We'll also send on the one, some information about sex and vaginal creams. We've got a sleep workshop coming up next in 2 weeks' time, but it looks to me like we need to do something on sex too. Because of course, you know, this one's entirely on aging, facial aging. But as you say, those sorts of things do affect how we feel, how we present ourselves, our relationships as well. So it's not all about Botox and fillers and things like that. And as I love the way you always say, nobody needs it. If they want it, it's a different matter. So I suppose in summary, we're looking at fluffing up the cushion with extra collagen, ironing the pillowcase with extra skincare, and you know, if you want it, if you think you need it, then a little bit of sympathetic restoration is probably the order of the day to keep it natural.
And Deborah, you mentioned sleep. Sleep is another important influencing factor. So as we start to, as women start to wake up early, this usually happens long before the hot flushes and the night sweats start. Sleep deprivation can make us age faster. So as part of hormone therapy, we tend to give micronized progesterone, which helps us to sleep better. It's the hormone that we have in the late stage of pregnancy, and it is calming and soothing. And we know that the lack of sleep is causing increased inflammation, and also an increase in DNA damage and a decrease of DNA repair. So not only does it have an impact on how you feel, your energy, and also, of course, if you're tired, you're not going to exercise so much, but and your relationship, it also has an effect on your skin, as do estrogens, which we haven't discussed yet. If you want, I can go over estrogens a bit.
So beauty sleep is really true then? It is beauty sleep.
100%, yeah, it is a beauty sleep.
Okay, so just to recap on some of your top tips then, the top 3 things you would highly recommend we all as menopausal women do.
Oh, 3 is tricky. I would probably say 5 or 6, but
you can go 5 or 6 then.
Number 1 is definitely photoprotection. That's so simple and everybody can do it. If you're smoking, stop smoking, low sugar diet, exercise. You know, we haven't really had yet the time to talk about the estrogen receptors and the effect it has on the skin, but estrogen, if you take it as part of systemic HRT, will have you know, a benefit on the thickness. It helps with collagen type 3 and the synthesis of elastic fibers, because we know that as we go through the menopause, the skin structure changes. So in the first 5 years of the menopause, you will have a decrease of 30% of your collagen, and then thereafter it's 2.1% less per year, and then it becomes thinner. But just to come back to your top tips, exercise, maybe have a break of eating in between, but again, that needs more research. But putting your body under stress, you know, exercising, that will help with the longevity genes, lots of things.
Lots of things. Well, we'll itemize all of these and get all of the notes sent out to everybody. And some of those questions were not specifically around menopause and aging. However, we've got answers to all of them. So I'll be going through the chat box and sending out some links to those of you who've asked questions. But Liz, I'm sure we're going to have you back again. Thank you very much. It's been an absolute delight. Thank you very much for answering all of the questions.